The way it all comes together, it's quite beyond anything I could have imagined. Every element works in perfect harmony, creating something greater than the sum of its parts. Oh hey, I didn't notice you there. I was just daydreaming about the kidneys. Speaking of which, this video is going to be all about them. The kidneys are among the most vital organs in the human body. They silently maintain balance by filtering our blood, regulating electrolytes, managing blood pressure, and producing essential hormones. Yet despite their importance, kidney disease is a global epidemic. More than 850 million people worldwide are affected by some form of kidney dysfunction, and it keeps increasing every year. To put it into perspective, that's more than double the number affected by diabetes. As kidney failure progresses, the body's systems begin to unravel, unless medical intervention steps in. Join us into the world of renal replacement therapy, where medicine, engineering, and human resilience converge to sustain life. In this explanatory video, we will explore the topics of anatomy and physiology of the kidneys, kidney pathologies, kidney treatments, the safety stuff, and finally everything about living with dialysis. You might ask, what is dialysis? Valid question. You'll get a valid answer to that too. 1.2 liters of blood. That's how much flows through both kidneys every single minute. That makes them, despite weighing only about 150 grams each, the most highly perfused organs in your body. Impressive for two little bean-shaped powerhouses. You've got two kidneys, one on the left, one on the right, sitting just below your diaphragm, next to your spine. They're tucked away behind the lining of the abdominal cavity, a spot known as the retroperitoneal space. Let's take a peek inside. Slice one open, and you'll see two main zones, the outer renal cortex and the inner renal medulla. The cortex holds renal corpuscles and parts of the tubule system. The medulla contains cone-shaped renal pyramids. At the center is the renal pelvis, a funnel where urine collects before it heads down the ureter. Everything, blood vessels, nerves, lymphatics, and the ureter, passes through a central gateway called the renal hilum. So, what are renal corpuscles and tubules? They're parts of the nephron, the kidney's smallest working unit. There are about 1 million in each kidney. Each renal corpuscle contains a tangled ball of capillaries called the glomerulus, wrapped in a protective layer called Bowman's capsule. Filtration. The kidney filters your blood under pressure to make what's called primary urine. This fluid then travels through a winding tube system. First stop, proximal tubule. Then a thin intermediate segment, and finally the distal tubule. The famous loop of Henle is in there too. It's key for concentrating your urine. All of it flows into the collecting duct. Here, a mix of secretion and reabsorption transforms the primary urine into secondary urine. That's the stuff we eventually pee out. As a vital organ, the kidney has 3 main jobs. First, it makes urine. This helps remove waste from the body, both natural leftovers and stuff like medications. We make around 1.5 to 2 liters of urine every day. Second, the kidney works as a fine tuner. It balances your body's fluid levels and electrolytes, helping to keep your blood pressure steady, whether it's a quick fix or long-term control. It acts as a pH manager. By adjusting the acid and base levels in your blood, it keeps your body's pH in the safe zone. So yeah, filtration, regulation, and waste removal. Not bad for a pair of fist-sized organs. But kidneys don't just filter and regulate. They're also hormone producers. Yep, they act like a tiny endocrine organ. They make erythropoietin, a hormone that tells your bone marrow to produce more red blood cells. Now let's wrap up by looking at what the kidneys keep and what they get rid of. The tubule system reabsorbs all sorts of important things, like water, glucose, amino acids, sodium, potassium, and more. But not everything gets a free pass. Some substances have to go. We call these obligatory urinary substances, things your body can't reuse and needs to excrete. The 2 biggest ones? Urea, a waste product from breaking down proteins, and creatinine, which comes from muscle metabolism. specifically from the breakdown of creatine phosphate. Without getting rid of these, toxins would build up fast. So yeah, kidneys are doing a lot behind the scenes. Altogether, these roles, filtration, regulation, hormone production, waste removal, make the kidneys absolutely essential for life. If they stop working, the body needs help fast. That's when treatments like dialysis step in to take over their job. Now that we've seen how the kidneys work, let's talk about what happens when they, well, don't. When the kidneys can't filter blood properly anymore, we call it kidney insufficiency. That means waste builds up in the body, and that affects everything. There are two main types. First, acute kidney insufficiency. It hits fast, over hours or a few days. Second, chronic kidney insufficiency. That one creeps in slowly, over at least 3 months. The difference matters. In chronic cases, the body can adapt a bit, but acute cases need quick treatment, urgently. Kidney function is measured using lab values. One key marker is creatinine. In acute kidney failure, it rises quickly. Another marker is GFR, the glomerular filtration rate. It shows how much blood your kidneys filter each minute. In acute cases, GFR might still seem normal at first. In chronic cases, it slowly drops over time. If GFR stays under 90 milliliters per minute for more than 3 months, it's considered chronic kidney disease. And if it falls below 15 milliliters per minute in either form, renal replacement therapy becomes necessary. Another red flag? Low urine output. Less than 500 milliliters a day is called oliguria, and if there's no urine at all, that's anuria. The main culprit? Urea. When it builds up, it leads to uremia, also known as urine poisoning. And uremia doesn't just affect the kidneys, it impacts the whole body. The skin may itch and even smell like urine. The heart and blood vessels are hit too, causing high blood pressure, fluid buildup, and inflammation of the heart lining. The lungs can fill with fluid or get inflamed, like in pneumonia. The digestive system may respond with nausea, bad breath, or diarrhea. Even the brain can suffer from inflammation, confusion, and seizures. Uremia can also reduce blood production, causing anemia and bleeding issues. Bones may weaken due to calcium phosphate imbalance, leading to osteoporosis. And yes, even nerves and hormones take a hit. Dialysis helps a lot, but not all symptoms of uremia go away with it. In Chapter 1, we learn the kidneys only work right if 3 things are in place. First, they need good blood flow. Second, the glomeruli, the filter units, must be intact. Third, urine must flow out freely. Depending on where something goes wrong, causes of kidney failure are sorted into 3 groups. Pre-renal, before the kidney. Renal, within the kidney. Post-renal, after the kidney. Let's start with pre-renal causes. These happen before the kidney and mostly affect its blood supply. Examples include severe blood loss from trauma or internal bleeding, leading to hypervolemia, meaning too little blood in the body. Heart failure, when the heart can't pump strong enough, so the kidneys don't get what they need. Cardiac arrest, if the heart stops, blood flow to the kidneys stops too. Narrowed blood vessels, like in arteriosclerosis, where hardened arteries restrict circulation. Next up, renal causes. These happen inside the kidney and damage its filtering system directly. Glomerulonephritis, an inflammation of the kidney's filters called glomeruli. It can show up suddenly and hit hard. Diabetic nephropathy, one of the most common causes of chronic kidney disease. If blood sugar stays high, above 170 milligrams per deciliter, sugar spills into the urine, pulling water with it. Over time, this overwork damages the filters. Star kidney tumors, like Wilms tumor, a cancer mostly seen in kids. Often, the affected kidney has to be removed. Polycystic kidney disease, a genetic condition where fluid-filled cysts slowly take over the kidney, destroying healthy tissue. These are just a few examples, but they show how many different ways kidneys can be affected. Finally, let's talk about post-renal causes. These happen after the kidney and affect urine drainage. In these cases, the kidneys might still filter blood, but the urine can't get out. For example, a kidney stone or tumor can block the ureter. the tube that carries urine to the bladder. This creates back pressure, which stops the kidney from filtering properly. If the pressure lasts too long, it can cause permanent damage. Here's some good news. If one kidney fails, the other can usually take over. That's why living kidney donation is possible. But if both kidneys suddenly stop working, like after severe trauma, urgent treatment is needed. This is where renal replacement therapy comes in, to take over the kidney's job and keep the body alive. So whether the issue is before, within, or after the kidney, detecting it early makes all the difference. From kidney failure to therapy, when the GFR drops below a critical level, and symptoms like fluid overload, high potassium, or uremia show up, it means the kidneys can't keep up anymore. Their job must be replaced by technology. There are two main options: kidney transplantation or dialysis. A transplant gives the best long-term results, but donor organs are limited and rejection is a risk. That's why dialysis is used most often around the world. The artificial kidney. How hemodialysis works. Hemodialysis is a blood cleaning method done outside the body. Blood is pumped through a filter called a dialyser using a special access point, usually in the arm. Inside the dialyser is a semi-permeable membrane. This lets small waste molecules move out of the blood and into the dialysis fluid, called dialysate. How? Through diffusion, where particles move from areas of high concentration to low concentration until things even out. A session usually lasts 4 to 5 hours and is done 3 times a week. Another key process is ultrafiltration. Water and small molecules are pushed through the membrane, while bigger things like proteins and blood cells stay behind. Let's look at a few other ways to clean the blood. Hemofiltration uses convection to remove waste. Here, plasma water is pushed through a membrane under high pressure. The lost fluid is replaced with a clean, sterile solution. One big advantage? It removes larger waste molecules, especially helpful in patients with sepsis or multiple organ failure. Hemodiafiltration combines both methods, diffusion and convection. That makes it even more effective, but it also needs more advanced equipment and monitoring. Finally, peritoneal dialysis relies on diffusion via the peritoneum, your abdominal lining. It allows for treatment at home and offers flexibility. A special fluid with glucose is placed into the belly through a catheter. After a few hours, it's drained and replaced. The benefit? It can be done at home, offering more independence and flexibility. But there's a higher risk of infection, and not everyone is a good candidate due to possible contraindications. Each method comes with its own strengths and challenges. But what can the artificial kidney not do? Despite its advances, the artificial kidney only replaces some functions. It cannot produce erythropoietin, which stimulates red blood cell production, or convert vitamin D into its active form. It also lacks the precise control of fluid and electrolyte balance that real kidneys provide. Dialysis supports life, but it's not a full replacement for the natural kidney. Now let's talk about safety. It's not automatic. It's the result of strict rules and regulation. Every dialysis machine, every artificial kidney, must meet high safety and quality standards. In the European Union, this is covered by the Medical Device Regulation, or MDR. In Germany, it's enforced through national laws like the Medical Device Implementation Act and the Operator Ordinance. These laws make sure devices are not only effective, but also safe, reliable, and traceable at all times. Dialysis machines are classified as electrical medical devices. That means they must follow strict international safety rules. These cover everything from electrical safety and electromagnetic compatibility to alarms and even home use requirements. But since dialysis deals directly with blood, even more regulations apply. Even the membranes inside a dialyzer, those thin semi-permeable layers that separate blood and dialysate, must meet exact performance and biocompatibility standards. To ensure long-term product safety, manufacturers must have a certified quality management system. They must also manage risks throughout the entire product lifecycle. And that's just the beginning. There are dozens more standards, from sterilization and fluid pathways
to software design and even user manuals. Dialysis involves it all: electricity, water, chemicals, code, and blood. Every element brings its own risks, and every risk needs its own protection.
What does living with dialysis look like? How does it influence the patient? Dialysis has a big impact on everyday life. Patients follow fixed treatment schedules, often spending hours at a clinic several times a week. There are dietary rules too, like limiting fluids, potassium, and phosphate. There's also the risk of complications, like low blood pressure during treatment, called hypotension, or infections at the access site. But it's not just physical. Dialysis can take a toll mentally and emotionally. Feelings of isolation, stress, and restrictions in work or social life are common. It's more than a medical procedure, it's a way of life. 3 times a week for several hours at a time, that means planning and living with limits. Many patients feel deep exhaustion after each session. This is called dialysis fatigue, and it can affect the rest of the day. Fluids are also a challenge. Drinking is tightly restricted, often limited to 500 milliliters plus yesterday's urine output. There are more hurdles. High blood pressure, sometimes caused by the treatment itself. Medications become routine. Heparin to prevent blood clots. Epoetin to treat anemia. Both are long-term companions, and then there's the risk of infection. Access points like shunts and catheters can get inflamed. Even internal organs may suffer. What's often missed? The emotional toll, anxiety, dependency, the constant pressure to keep going. Many patients face depression or quietly pull away from social life. Conversations can help. Talking helps, whether with professionals or fellow patients. Because illness doesn't just affect the body, it touches the whole person. And still, many people live actively. They work, they travel. With good planning and support, much is possible. Patients have a say in their treatment, even in deciding to stop it, because dialysis extends life, but it doesn't cure kidney failure. Toxins may still build up. Symptoms like itching, nausea, and trouble concentrating often remain. Some patients choose to stop dialysis. That's allowed and ethically accepted, because in the end, quality of life is what truly matters. With or without dialysis, one thing stays at the center: the patient's wishes. Let us look ahead. The future of kidney care is full of promise. Researchers are aiming high, developing wearable dialysis systems for more freedom and flexibility. Another vision? Bio-artificial kidneys. They blend tech and living cells to copy what real kidneys do. These aren't just hopeful ideas. They point to a future where treatment doesn't just replace, but restores true kidney function. Not just detox, but real living equivalents.